Hello friends, my name's Mark. I'm an OET tutor and a journalist from the UK, and I'm here once again to help you pass the OET writing section with flying colours. And to achieve that, I have authored a book called OET Medicine Writing Success, 5 endocrine case studies with model letters and exam tips. And I want you to have a copy of this book for free. That's why if you go down to the description of this video below, you're going to find a link where you can download it for free. In this video, we're going to go through case study number 2, which is a transfer letter for a patient with suspected Pheochromocytoma. So let's get straight into it and find out how to write a model OET writing transfer letter. Once you've downloaded the book, if you scroll to page 20, you're going to find case study number 2. It says, let's assume today's date is the 15th of December 2024. We are working in an A&E department, and we've received on the 12th of December a patient by the name of Miss Laura Davies, who is 34 years old, a software engineer who lives alone, reports work-related stress, and is presenting with a provisional diagnosis of Pheochromocytoma based on symptoms which include palpitations, sweating, and a severely elevated blood pressure of 210 over 120. She has no significant medical background. In terms of family history, her mother has hypertension and her father type 2 diabetes. The investigations that have been carried out show elevated plasma-free metanephrines, which are 2.5 times the normal range, and a CT abdominal scan showed a 3.5 centimeter hypervascular adrenal mass. The management which we've initiated includes through IV of phenoxybenzamine, which is to manage her hypertensive crises. We've achieved cardiovascular stabilization, but the hypertensive crises persist, and cardiology and anesthetics teams have been consulted for risk assessment and perioperative planning. So on the 15th of December, which is the date that we're assuming it is, we are going to be writing a transfer letter to Churchill Hospital's endocrinology department, specifically to a Dr. Angela Carter, and we are going to be asking for the optimization of preoperative condition for the adrenalectomy. We're going to ask for an MIBG scan to be arranged to confirm our provisional diagnosis, and that is all that we want to request. So let's jump straight in to the letter, starting with the top part. So if you go to page 12 of the OET Writing Success book that you've already downloaded, you're going to find the optimal structure for an OET letter. So it says, let's start with the address, which we're going to find right here in the writing task. So we'll copy and paste that in. Now we've got the address. What comes next is going to be the date on which we're writing. So the date, it says, is the 15th of December 2024. So we'll put that information in next. Then we want to put in Dear, the person to whom we're writing, which is Dr. Angela Carter. Then we want to put in the subject line, and the subject line is going to be RE, then the name of the patient, which is Miss Laura Davies. Then we want to put in the date of birth of our patient, which is the 4th of June 1990. So just like that, we've got the top part of our letter done. And what comes next is the introductory paragraph. If you go to page 6 of the same book, you're going to find the structure that we want to follow for our introductory paragraph. In short, we've got these 4 W's, the who, the what do we want, why we want it, and the when, which is something about the time span of the patient's symptoms. We want to collect this information from the case notes and then condense it into 2 neat sentences. So let's start off then by searching for this information. So it says who. So that's going to be Ms. Laura Davies, and we want to say a 34-year-old software engineer. What do we want? Well, that's going to be urgent inpatient management. And why do we want that? That's going to be because she has suspected Pheochromocytoma. Namely, well, one of the symptoms that she's had, which is suggestive of this, would be recurrent hypertensive crises. And then when, so something about the time span of the patient's symptoms, and that would be over the past 3 days, because she was admitted on the 12th of December and today is the 15th. So now then, it's just a question of turning these 4 W's into 2 neat sentences. So we're going to say, I am writing to transfer, right, Ms. Laura Davies, a 34-year-old software engineer, for urgent inpatient management of suspected Pheochromocytoma. She has experienced recurrent hypertensive crises over the past 3 days. So we're going to start with the information from the admission and the symptoms with which the patient presented when we first received her. So we'll turn these notes here into full sentences. We're going to say Miss Davies was admitted to John Radcliffe Hospital on the 12th of December 2024, presenting with severe headache, palpitations, sweating, and blood pressure of 210/120. Then we're going to move over to the information about investigations carried out. So how can we turn this into full sentences? Well, we can write blood tests revealed elevated plasma-free metanephrines, in brackets 2.5 times the upper limit of normal, and a CT abdominal scan revealed a 3.5 centimeter hypervascular adrenal mass. So there we've included the information from the investigations. We're going to now add on more information, this time about the management that we've initiated of our patient. So how are we going to convert this information into full sentences? Well, very much the same as we've been doing. So we'll say, despite initiating IV phenoxybenzamine, her blood pressure remains unstable with intermittent hypertensive spikes. So that's this information included. And then we'll say cardiology and anesthetics teams have been consulted for assessment and peri-operative planning. Now then, we might want to include a bit of information from the social background. We're putting this lower down the letter because the less important and the less relevant for continuing care, the lower down we're going to put the information in our letter. So let's now include some of this. So we'll write, Ms. Davies lives alone and has no significant prior medical history or allergies. We'll say she has a family history of hypertension. Then we'll put in brackets mother. Probably won't bother mentioning the type 2 diabetes on her father's side because it's not especially relevant for the case that we're dealing with. So now what we want to do is write the request paragraph, and we're going to base the request paragraph on the plan information here. And of course we're going to use very polite language in order to make a request of our colleague, the consultant endocrinologist. So we could write, I request the urgent transfer of this patient to Churchill Hospital endocrinology unit. And what is it that we want? Well, we want further diagnostic evaluation, including an MIBG scan, and also optimization of her preoperative condition. Okay, and then we'll say your guidance on definitive management, including adrenalectomy planning, would be greatly appreciated. And then we'll just finish up as we always do. Please do not hesitate to contact me if further information is required. And then we finish up by saying, yours sincerely, A&E doctor. And how many words have we got here? The body of our letter is 174 words. So we've gotten exactly to the lower limit of what the OET wants, which is 180 to 200 words for the body of our letter. Well, if you've made it all the way to the end of the video, I want to thank you for your time and congratulate you on your dedication. If you're looking for one-to-one OET preparation classes and you need help either with the writing section or the speaking or the reading or the listening, then you can contact me at the link that you find here on page 3 of the book, or you can find the same link in the description of the video down below. If, on the other hand, you're not interested in video conferencing classes, but instead you'd just like my opinion on your writing, then you can contact me at the link that you're seeing now, which is buymeacoffee.com/OET Writing. You're going to find this also in the description down below, and I'll send you a totally new case study for you to write, and then when you send it back to me, I'll mark it, I'll give you detailed feedback, and I'll send you a Word document with all the advice that you need in order to take your performance to the next level and get that grade that you need in order to get the dream job that you're looking for in an English-speaking healthcare system. So thanks again for your time, and don't forget to check out, if you haven't seen it already, on my channel, the first video in this series in which I go through a referral letter, which is case 1 in the book for a patient with suspected hypothyroidism. And drop me a comment down below to let me know where you're listening to me from in the world and what medical specialty you work in. And of course, give the video a like if you feel so inclined to do so. And of course, subscribe to the channel, because in future videos, I'm going to be going through the other remaining 3 case studies from this book. And I'm also going to be releasing a new book, which is not about endocrine case studies, but instead it's going to be a complementary book about patients with neurological issues. So you'll have lots more practice material. So subscribe to the channel, and once again, thanks for your time, and I'll see you next time.